You're watching Canadian Muslim News on Muslim Network TV from Toronto, Ontario. I'm Samia Sayed. Welcome to the show. Coming up later, we have an interview with the Muslim Medical Association of Canada over a recently published Islamophobic article and where the hijab was referred to as an instrument of oppression. But first, let's go over some headlines. Deadline expires on child welfare decision for government and Indigenous groups. Government expands eligibility for $300 a week COVID benefit. More Americans say they have no affiliated religion. The world celebrates and welcomes the new year. And now the details. Parties involved in the dispute over court-ordered compensation towards the Indigenous child welfare system will not meet their self-imposed deadline of December 31st. Emails gathered by local media sources report that both parties say negotiations are still ongoing. The parties have not indicated any move to involve the court. The dispute has been ongoing since 2016, following a court order for the government to direct $40 billion towards compensation and reforming the First Nations child welfare system. The federal government has been in negotiations with the First Nations groups to discuss the settlement since October. Applications for Canada's worker lockdown benefit are now open for several provinces and territories, announced the government today. People who have had their workplace capacity limited by 50% or more can apply for the program. Recipients can be eligible for up to $300 a week until May 7th. The program was previously announced in November. Due to its strict eligibility criteria, almost no province or territory qualified for the benefit. This extended eligibility will only be open until February 12th. Government officials in Saskatchewan and Yukon announced that they will not introduce restrictions in the holiday season and are thus not eligible for the benefit. The percentage of adults who identified as not having a religious affiliation has increased during the pandemic. A Pew Research Center survey shows that 29% of adults in the United States said that they have no religious affiliation, which is 6% higher from 2016. Pew also reported that about 1/3 of the U.S. adult population say that they are hardly or never pray, a number that has nearly doubled since 2007. Gregory Smith, an associate director of research at the center, says that secularizing shifts evident in American society in the 21st century shows no signs of slowing. Countries around the world prepare and celebrate as they all welcome the new year 2022. Flower markets in Delhi, India were filled with blossoms and customers until late in the evening. Sydney welcomed 2022 with a midnight fireworks display over the Opera House and Harbour Bridge. New Year's gatherings and fireworks have been cancelled in multiple cities across Canada over concerns of the Omicron variant. Canadians are urged to check their public health guidelines before engaging in the New Year's celebrations. That's it for our headlines, and now we have an interview with the Muslim Medical Association of Canada, otherwise known as the MMAC, regarding a controversial and seemingly Islamophobic letter that was published in the prestigious Canadian Medical Association Journal, or the CMAJ. The letter referred to a hijab as an instrument of oppression, and since then, interim editor Kirsten Patrick apologized and retracted the letter from the journal. To speak to us today regarding this topic, we have Dr. Arfin Malik, the MMAC's Director of Mental Health. Welcome, Dr. Arfin. It's great to have you here.
Thank you very much for having me, Samia.
So I told the viewers a little bit about the article itself. Can you briefly let us know, how did MMAC find out about the article?
Yeah, assalamu alaikum, everyone. The way that we found out about the article is really through the strength of our MMAC network. So the Muslim Medical Association of Canada, we have a very strong network of Muslim medical professionals, including residents and students. And what this means is that we communicate on a daily basis about articles that come out, about new literature, and about things that are impacting Muslim patients in Canada. And so this article really came up with multiple people messaging us from the MMAC organization, highlighting that they had read this article and the outrage that they really experienced and hurt that they experienced after reading the article.
Mm-hmm. And so once MMAC found out about it, what did they do once they heard about that it was circulating around?
So us at the Muslim Medical Association of Canada, we represent, over 700 trainees, from medical students to residents to staff, really across Canada, so nationwide. And so what we did is really we spoke together as our network. We have a equity, diversity, inclusion, advocacy, and justice working group, and we really discussed this together about what the approach would be moving forward. Our president and our board members also reached out to NCCM, the National Council of Canadian Muslims, and we really worked together with the organization to advocate and really issue and demand, both privately with the CMAJ and also publicly with the CMAJ, to have the letter removed, for there to be acknowledgement of the errors that were made, and for there to be a formal investigation into how this letter was actually published in an academic journal in Canada.
Mm-hmm. And was it hard making these demands from the CMAJ for them to publicly apologize and retract the letter and install an investigation?
So really, there are lots of layers to how we approach this. One is to actually, reach out to the editor herself. So reached out to Christy herself as the MMAC and as NCCM, and we really wanted to thank the Chief Operating Officer, Dr. Nadia Hassan, who really represented the MMAC on her conversation, advocating for this letter to be removed and for this to be addressed immediately. Because this letter really came out over the holidays, it became really hard for us to be able to even contact individuals and get immediate action. And also, when we have medical journals, what we know it is very hard to actually get things retracted and then also removed. What we did see, though, was that within 48 hours, with work from the NCCM and the MMAC, we were able to get the letter retracted, which is actually really significant, and also a very important and needed step that was made. It has now been fully removed. And, really our concerns were that there could be potential harm if this letter continued to circulate in its form. So, there was lots of steps that were made. The next step for us as the MMAC is for us as a board to meet with the editor from CMAJ and for us to be able to represent our views and our requests to ensure that further harm is not done and that this really never occurs again in the Canadian Medical Journal.
And I'm glad to see that this was a joint operation from both the MMAC and NCCM as Muslim organizations to really defend ourselves out there. And so my next question is, what is wrong with a healthcare provider referring to a hijab as an instrument of oppression?
There's so much with that question, Samia, because us as healthcare professionals, we are in our role, we come into this to be able to serve patients of diverse backgrounds. And, there's been a lot of discussion around equity, diversity, and inclusion, but these are hallmarks of medicine. And part of our Hippocratic oath that we take as physicians is to be able to treat people in the same manner and to be able to allow us to be able to give equitable treatment to our patients. When we have biases and stereotypes like this that come out by physicians, what we see is that it has a detrimental effect on patients and their patients' experience in our medical system. So, our medical system is a public one here in Canada, but that does not mean that there's a fair and equitable way in which diagnoses are made, way in which treatments are accessed. And we know that these kind of biases can exist and can be really harmful to patients. So, an example of this would be the really harmful stereotypes of Indigenous individuals as having substance use disorders. And this has been a prevalent stereotype that has been harmful to Indigenous communities and Indigenous members who then enter into our medical system and are stereotyped in this manner. Similarly, with individuals who identify as Black, there has been a stereotype of individuals who are Black as being violent in the media. And this has been for centuries that these kind of stereotypes have been propagated. But what we see in medicine is that what happens is there's an overdiagnosis in the Black community of behavioral disorders like oppositional defiant disorder, ADHD, and there's a lack of acknowledgement for the social determinants of health that impact the population. Similarly, with hijab-wearing Muslim patients, there's now the stereotype that Muslim hijab-wearing patients are oppressed, that they are of need of saving, that they are forced into their Islamic beliefs and their practices. And this is really harmful in medicine, as we've seen with the examples I've provided.
So you went over, and CMAJ's apology also mentioned that their editing process was biased and flawed. And so what can be done in the future to prevent something like this?
You know, there's lots of steps that are taken when an academic journal publishes a letter, publishes an article, publishes a commentary, and those steps were not taken for this publication. And we want to know why. We really want to know why that is. And we think there should be a formal investigation as to why it is that this article was able to be published without there being any peer review process and the normal, steps that are taken with academic rigor based on evidence base when an article is published. So this article, what we've seen in the media recently is that there's an explanation that this article was published because of the opinion of one individual who had really harmful religious experiences growing up, shared those experiences with Dr. Amel, and Dr. Amel published that to stereotype the experiences and views of individuals wearing hijabs in Canada. The problem with that approach is that it's not evidence-based, it's opinion-based. And what happens is that you have experiences of one individual that are stereotyped to the experiences of all. What we do know as a Muslim Medical Association of Canada is we represent, as I mentioned, over 700 Muslim physicians in Canada, and this does not speak to our experience. So we're wondering, why is it that this voice was provided a platform? Why is it that this went through the channels and did not have a peer-reviewed process by other individuals of the CMAJ?
The editor posted an apology on Twitter as well as their website, and shortly after, Dr. Sharif Emil also posted an apology regarding this letter that he authored. Is it fair that this Dr. Sharif Emil is getting so much backlash regarding his publication?
I think it's important for us to just consider the impact. Consider the impact that this would have for patients who are Muslim, who either will train under Dr. Emil, who either will access services under Dr. Emil as a pediatric surgeon, and the concerns that individuals may have that Dr. Emil may hold these type of stereotypes based on the experiences that he's noted in this article. He's even noted a few experiences in his interviews with the media, which continue to stereotype Muslim Canadians. And unfortunately, this does not represent the experience of Muslim hijab wearing Canadians. This represents the experience of individuals in other countries and perhaps individuals who, we really deeply feel concerned that they have experienced, religious oppression. However, when we have patients in Canada, we cannot extrapolate their experiences to these personal challenges that people have faced in other countries or on an individual level.
And thank you so much, Dr. Arfin. I would have to stop you there. Unfortunately, we've run out of time for today's interview, and we just touched upon the subject, but you did a great job, mashallah. Thank you so much for coming on our show and joining us to tell us about this article by the CMAJ. It was great to have you here.
Jazakallah khair, Samia. It was my pleasure to be here. Thank you.
You were watching Canadian Muslim News on Muslim Network TV. That's it from our Toronto studios tonight. Make sure to like and subscribe to our channel for more Canadian Muslim content. But in the meantime, stay safe and Happy New Year.